CF is a genetic disease caused by the mutation of the CFTR gene located on chromosome 7. CFTR is a protein that forms within the cells and acts as an ion channel which allows chloride to flow out of the cell. The mutations of the CFTR DNA code from the disease can alter and lead to the reduction in the CFTR protein that reaches the cell surface. This means there is a high amount of sodium absorption in the epithelial cells and decreased chloride secretion, which causes impaired movement of water in and out of the cells, thus resulting in the thick abnormal mucus production in the lungs, pancreas, gut, and many other organs in the body. This compromises the body's mucus clearing and leads to pathogen colonization, which results in the constant infectious state that patients can attain. To have a diagnosis of cystic fibrosis, a child must inherit one copy of the CFTR gene mutation from each of their parents. People cannot have CF with just one copy of the CFTR gene mutation. They are just considered CF carriers. There are several ways to diagnose the disease. This includes newborn screening, a sweat test, genetic or carrier test, or to receive a clinical evaluation at a CF Foundation accredited care centre. There are over 2,000 mutations of CFTR, of which all vary in their clinical consequence. The mutations in CFTR have been categorized into 6 classes, and some are more defective than others. The severity of cystic fibrosis may be determined and influenced by the mutation class, modifier, genes, and the presence of complex alleles. In Australia, 90% of patients diagnosed with CF have the F508del mutation. This mutation is classed into class 2. The effect of this mutation is that the CFTR protein is misfolded and retained in the endoplasmic reticulum and subsequently degraded. The required approach for this class of mutation would be to correct the protein folding. Other examples of this class of the class's effects include no CFTR being produced, the impaired CFTR channel regulation and opening, reduced conduction across the channel, reduced synthesis of CFTR, and decreased CFTR stability. Some of the most common clinical manifestations of CF include sinusitis, nasal polyps, respiratory failure, excessive sodium loss in sweat, infertility in men, arthropathy, osteoporosis, and gastrointestinal system problems such as pancreatic insufficiency, diabetes, and intestinal obstructions. Trikafta belongs to a group of medications called cystic fibrosis transmembrane conductance regulator modulators. Trikafta can come in the form of tablets or granules for younger children aged 12 and below. There are 2 doses of Trikafta, and they require 12 hours in between each dose each day. The morning dose contains elexacaftor, tezacaftor, and invacaftor, and the evening dose contains invacaftor. Trikafta is a prescription medicine indicated to treat cystic fibrosis in patients aged 2 years and older. For this drug to be effective, the patients must have at least one copy of the F508del mutation in their CFTR gene, or another mutation that has been found to be responsive to treatment with Trikafta. The mechanism of action for Trikafta includes CFTR correctors that bind to different sites on the CFTR protein and have an additive effect of processing the F508del CFTR to increase the amount of CFTR protein that is delivered in the cell surface. The drug can open the ion channels of the CFTR at the cell surface. This has the effect to increase the quantity and function of the F508del CFTR at the cell surface. This can result in increased activity from CFTR protein and mediates chloride transport. Clinical outcomes of Trikafta indicate that a single F508del mutation is sufficient to result in a significant clinical response from the patients. Significant clinical outcomes that have been found from the drug include decreased sweat chloride, increased BMI, increased lung function, fewer pulmonary exacerbations, and improved CF respiratory symptoms. There are many considerations for nursing when caring for patients that are on Trikafta or beginning to take it. The nurse needs to ensure that the patient and their guardian are educated on how Trikafta works and what it is for. Additionally, Additionally, when the drug needs to be taken, Trikafta comes in tablet or granule form and must be taken in a morning and in evening dose, 12 hours apart. If a dose is missed, you can take it within the first 6 hours of missing it. If it has been over 6 hours, the dose needs to be taken immediately and the next dose needs to be skipped. It is vital to ensure the patient takes each dose of Trikafta with a fat-containing food, as this will help the body absorb the drug effectively. It is important to educate the patient that while on Trikafta, you cannot consume any grapefruit products and to educate them on any side effects to look out for. Some normal side effects include headache, common cold symptoms, diarrhea, stomachache, rash, blocked nose, runny nose, slight temporary increased high blood pressure. And some serious side effects to look out for include liver damage and worsening of liver function and high liver enzymes in the blood. Some signs of these may include significant pain in the upper right abdominal area, yellowing of the skin or white parts of the eyes, loss of appetite, nausea or vomiting, and dark urine. Nurses should check patient's allergy and past medical history before administering the medication and make the patient aware of any medication that would contraindicate Trikafta. These include antibiotics, seizure medications, herbal medicines, antifungal medication, immunosuppressants, cardiac glycosides, anticoagulants, diabetic medications, medicines for lowering blood pressure or blood cholesterol. Finally, ensure the patient is aware that this won't cure their CF and Trikafta needs to be taken continuously for it to be effective.